Welcome to British Biomedicine Institute. Today we will explore imaging of cardiovascular system in radiodiagnosis. Cardiac imaging refers to non-invasive imaging of the heart using ultrasound, magnetic resonance imaging, MRI, computed tomography, CT scan, or nuclear medicine, NM, imaging with PET, or SPECT. These cardiac techniques are otherwise referred to as echocardiography, cardiac MRI, cardiac CT, cardiac PET and cardiac SPECT, including myocardial perfusion imaging. Interventional radiology uses imaging to help guide doctors when they are inserting catheters, wires, and other small instruments into your body. Cardiovascular radiologists can screen for heart disease or diseases of the blood vessels, determine what is causing your symptoms, monitor your disease and determine if your treatment is working. Doctors can use this technology to diagnose a procedure called angiography or to treat a procedure called angioplasty, heart and blood vessel blockages, without actually having to perform surgery. Transthoracic echocardiography uses ultrasonic waves for continuous heart chamber and blood movement visualization. It is the most commonly used imaging tool for diagnosing heart problems, as it allows non-invasive visualization of the heart and the blood flow through the heart using a technique known as Doppler. Transesophageal echocardiography uses a specialized probe containing an ultrasound transducer at its tip is passed into the patient's esophagus. MRI is able to measure the size, shape, function, and tissue characteristics of the heart in a single session. It is more reproducible than echocardiography, with less inter-observer variability, allowing for more precise reference ranges to better distinguish health from disease. An MRI scan cannot be performed in some people who have metallic implants, such as some types of pacemakers, defibrillators, although many modern pacemakers are safe for use within an MRI scanner. Computed tomography, angiography, CTA, an imaging methodology using a ring-shaped machine with an X-ray source spinning around the circular path so as to bathe the inner circle with a uniform and known X-ray density. A coronary CT calcium scan is a computed tomography CT scan of the heart for the assessment of severity of coronary artery disease. Specifically, it looks for calcium deposits in the coronary arteries that can narrow arteries and increase the risk of heart attack. Cardiology users are growing with the incredible developments in CT technology. Currently, multi-detector CT, especially the 64-detector CT, are allowing to make cardiac studies in just a few seconds, less than 10 seconds, depending on the equipment and protocol used. These images are reconstructed using algorithms and software. Great development and growth will be seen in the short term, allowing radiologists to diagnose cardiac artery disease without anesthesia and in a non-invasive way. Thank you for showing interest in British Biomedicine Institute Skilled Nano-Degree Program. Hope you have gained a lot of clinical information through this presentation. Please share, like, and subscribe British Biomedicine Institute channel. Good luck.